Minister of Public Health, Social Development and Labor, the Honorable Richard Panafleck, Dr. Raisa Chonkonfat, epidemiologist, online viewers and radio listeners via St. Martin Gov Radio 107.9 FM and respective radio stations island-wide. I'm Roleika Roach of the Department of Communication, and on behalf of the Minister of Public Health, Social Development and Labor, I welcome you to this public briefing with regards to an update on St. Martin's public health and COVID-19 developments. For more on this subject, I would like to invite the Minister of Public Health, Social Development and Labor, the Honorable Richard Panafleck, to address you.
Thank you, Ms. Roach. Members of the media, online viewers and listeners, good morning. Almost 4 months ago, the people of St. Maarten had to begin living in a new normal and wearing masks, practicing social distance and exercising increased hygiene measures, such as sanitizing your areas and washing your hands often. We saw then that through strict enforcement of these measures, we were able to contain the spread of coronavirus known as COVID-19. Sadly, today, I must inform you that based on the latest available data provided by the Collective Prevention Services, as of 6 p.m. on Wednesday, St. Maarten reached a new total of 94 confirmed COVID-19 cases. 16 of these cases are currently active and were reported during the past 72 hours. CPS is monitoring these 16 active cases and has also initiated source and contact tracing to ensure that the virus is quickly contained. The contact tracing measures are also necessary to ensure that persons who came into contact with confirmed COVID-19 cases are placed in quarantine and given information of COVID-19. While these persons are in quarantine, they will continue to be monitored by CPS. Persons that are required to quarantine are isolated, must stay at home, and limit contact with all other persons, including their own family. Of the 16 active cases, 2 were reported on July 24th, 3 on July 22nd, and 10 on July 23rd. The positive cases are in isolation, with 1 confirmed case admitted to St. Maarten Medical Center. It is important to know that this sudden spike in cases over the past few days has been mainly local transmissions, of which 3 cases are confirmed as being travel-related via the repatriation flight from the Dominican Republic on July 22nd. As part of the Ministry of Health's effort to protect the citizens of St. Maarten, some 143 passengers have been tested at the Princess Juliana International Airport over the past week as residents continue to return home on repatriation flights. General practitioners and CPS are also ensuring that symptomatic persons who have made themselves known are tested routinely. We take some solace in knowing that in contrast to last March, when we had our first cases, CPS, the local labs and government are better equipped to deal with the potential COVID-19 outbreak. It is because of CPS contact tracing on the newly reported cases, we have been able to identify and test others. CPS will continue this process to contain the spread of the virus, but the citizens of St. Maarten must continue to do your own part to flatten the curve. This virus can only spread through human movement and contact. Therefore, I strongly urge the general public to remain vigilant and do everything necessary to mitigate the further spread of COVID-19 and keeping yourself safe. We must all do our part in the fight against COVID-19 and not become complacent. The government of St. Maarten and the Ministry of VSR, with the help of the local law enforcement, will strictly enforce all social measures as has been communicated constantly to the further spread of COVID-19. St. Maarten has and continues to be tested, and we have endured the worst of times in the past. Through those tests, we have shown real strength of character. We cannot afford to let down our guard at this stage, as the evidence is clear that the fight against COVID-19 is not yet over. Your call to action in the past to adapt the new social norms results in 63 persons recovering from the COVID-19, and until now we were able to keep our numbers of infected persons from increasing. We must protect ourselves and families by wearing masks in public places, staying home, avoiding crowded areas, maintaining a proper social distancing of 2 meters from other persons, coughing or sneezing into your elbow or a napkin, and washing your hands often with soap and water or sanitizer. If you are experiencing the flu-like symptoms, stay at home. Call your family doctor. If you have any cause for concern, please call CPS at 914-914. As government, we will continue doing our utmost to keep the public safe. I ask for your cooperation during this difficult time and encourage you to pay strict attention to the safety protocols and social distancing measures to avoid any further shutdowns at this time. We each have a role to play in the fight to reduce the spread of COVID-19. Respect yourself and the person next to you. Wearing a mask is cool. Not wearing a mask is cruel. Don't be cruel. Wear a mask, protect yourself and others. And now I would like to pass the word to Dr. Raisa. Thank you.
Thank you, Minister Panafleck. I would now like to invite Dr. Raisa Chongkongfang, epidemiologist of St. Maarten. You have the floor.
Thank you, Ms. Roach, and thank you, Minister. Good morning to the public of St. Maarten. So as I was just saying, my name is Dr. Raisa Chongkongfang. I'm a medical doctor and epidemiologist specialized in infectious disease control, and I have been providing support to St. Maarten from the RVM, and I'm currently working at Collective Prevention Services. From CPS, we would like to expand on what the Minister has stated regarding the current situation on St. Maarten. As of 23 July 2020, there have been a total of 94 persons with a laboratory-confirmed COVID-19 infection. Of these 94 persons, 16 persons are actively being monitored by CPS, 63 persons have recovered from COVID-19, and 15 persons have passed away. I would like to take everyone back a little bit. Up to mid-May, we had 77 confirmed cases of COVID-19 on St. Maarten. Following this last case in May, there was no reported cases of COVID-19 on St. Maarten until July 2020. Since this month, we have seen an increase in the number of cases, with a first case reported by the laboratory the 1st of July, a second case on the 14th of July, 2 cases on the 20th of July, and 13 cases reported between the 22nd and the 23rd of July. So far, the majority of the cases cannot be traced back to travel to another country. CPS is currently still investigating what could be the possible source of the infection for the new reported cases. As the Minister has already stated, for all new cases of COVID-19, per the procedures at CPS, we have initiated source and contact tracing. All individuals that have been identified as having had close contact with the person with a COVID-19 infection are placed in quarantine and receive information from CPS on COVID-19. Over the course of the quarantine period, we contact these persons to ask whether they have developed symptoms in these 14 days. If they develop symptoms, they are tested by CPS. We would like to please urge the persons that are in quarantine to stay home and have no contact with other persons, including their own family. Please protect your family, friends, and the public of St. Maarten by staying home. Much like what was mentioned at the start of the epidemic in March and what CPS has continuously been communicating to the public, we would like persons to remain vigilant and to stay at home if they are not feeling well. If you are experiencing flu-like symptoms such as a cough, a runny nose, a sore throat, fever, please stay home and call your family doctor. The public, we would like to ask if they can keep themselves safe by washing their hands often with water and soap. And if you need to cough, sneeze, please do so in your elbow or in a tissue. Keep at least 2 meters of distance between you and all other persons, and wear a mask if you're going into public places where social distancing cannot be maintained. We will keep reminding the public to remain vigilant and to follow these prevention measures. CPS is continuously monitoring the situation with COVID-19, as we have been since the start of the pandemic. If you have any additional questions or concerns, call us at 914. Thank you very much.
Thank you, Dr. Chonkonfat, for your opening statements. Honorable Minister of Public Health, Social Development and Labor, Richard Panafleck, Dr. Raisa Chonkonfat, epidemiologist, radio listeners, and online viewers. This brings us to the end of the live public briefing today, Friday, July 24th, 2020. For rebroadcast, tune into St. Martin Cable TV, channel 115, St. Martin Gov Radio 107.9 FM, the official Facebook page of the Government of St. Martin, and the YouTube channel Government of St. Martin. For video on demand, log on to the official government's website at stmartingov.org. On behalf of the Department of Communication and the Government of St. Martin, I'm Relaika Roach and wishing you a pleasant day and weekend further. Thank you.